How to avoid the first step trap in EPP exam questions. First step questions on the EPP exam give you a scenario and ask which action should come first. The scenario contains information about where you are in a professional process at a particular moment. It might indicate that you are at the beginning of a first contact, midway through an assessment, responding to a new development in an ongoing case, or working within a specific setting that has its own procedural requirements. Reading for these details is what tells you the correct first step. Scenarios provide different types of information that help locate you in a professional process. The stage of the professional relationship is one signal. A first contact places you at the beginning of the process before foundational steps have been completed. An ongoing case places you further along with some of those steps already behind you. The setting is also important because different contexts such as outpatient intakes, hospital consultations, and forensic evaluations may follow different procedural sequences. Paying attention to what the scenario has already established is equally important. If an intake has been completed, consent and initial information gathering are behind you. If the psychologist is meeting with the client for the first time, those steps are still ahead. For example, a psychologist has just completed an intake session with a new adult client who reports persistent depressed mood, disrupted sleep, and loss of interest in daily activities over the past several months. The client also mentions having worked with a previous therapist for 2 years before stopping treatment 6 months ago. The exam question asks for the most appropriate next step. Answer choices include conducting a suicide risk assessment, reviewing records from the prior therapist, discussing treatment goals, and contacting the previous therapist for collateral information. The scenario places you at the beginning of a professional relationship, with the intake just completed and significant depressive symptoms already disclosed. These details tell you the clinical picture is still being established and the symptoms raise a question about safety. Risk assessment is the appropriate first step because these specific details place you at a moment where it is the most foundational action available. Another example is a psychologist who has completed a clinical assessment with an adult client referred for diagnostic clarification. The question asks for the most appropriate next step. Answer choices include giving feedback to the client, sending treatment recommendations to the referral source, scheduling additional testing, and scoring and interpreting the assessment data in light of the referral question and clinical history. The question places you after assessment information has been collected, but before the results have been interpreted. That means feedback and recommendations are later steps. Additional testing may be appropriate if the available information is incomplete, but the question does not establish that. The appropriate next step is to score and interpret the assessment data, because the psychologist has collected the relevant information but has not yet reached the point where conclusions can be explained or recommendations can be made. A practical way to handle these questions is to focus on the action words in the answer choices. Is a psychologist being asked to assess, obtain consent, administer a test, interpret results, explain findings, make a recommendation, begin treatment, consult, document, or follow-up? Each action belongs to a different point in the process. Testing cannot begin until consent is in place. Interpretation requires collected data. Feedback requires completed interpretation. Recommendations need a clear referral question and enough information to support the conclusion. Treatment begins after the client's needs, goals, and options have been discussed. Follow-up comes after an initial response. Also watch for answer choices that quietly include words such as after, following, based on, or then. Those words often signal that the answer depends on something the question has not established. If an answer choice depends on a missing step, it belongs later in the sequence.